Good evening. In view of the Prime Minister's broadcasts and Downing Street briefing, I want to provide some clarity for residents of Ashbourne and our surrounding villages. The priority still remains the same: to save lives, protect our NHS so that it doesn't become overwhelmed. The 5 steps remain in place. These are: number 1, that there is sufficient critical care capacity across the UK. Number 2, there is a sustained and consistent fall in daily deaths. Number 3, that the rate of infection is decreasing. Number 4, testing and PPE must be available and able to meet the demand. And number 5, we must be confident that there isn't going to be a second peak. We know that other countries like South Korea, China and Germany, who have eased their lockdown, have seen a spike in the number of deaths of COVID-19. We now have a new 5-point alert level. Number 1 is where the disease is no longer present in the UK. Number 2, COVID-19 is present in the UK, but the number of cases and transmission is low. Number 3, COVID-19 epidemic is in general circulation. Number 4, COVID-19 epidemic is in general circulation and transmission is rising high or fast. Number 5 is the same as number 4, but there is now a material risk of healthcare services being overwhelmed. During the last few weeks of lockdown, we have been at level 4. We are now beginning to move into level 3. So the testing and tracing will continue to be increased. This will enable local flare-ups of COVID-19 to be picked up quickly and also give a better picture nationally to enable our scientists to get the measure of this disease. So what happens now? From Wednesday, employers must follow the new COVID-19 secure standards. These will be put in place to keep everyone safe. Social distancing of 2 meters must be maintained. Anyone who can't work from home should be encouraged to go to work as long as it's safe to do so, i.e. if the employers have the COVID-19 secure standards in place, but they are to travel to work either by car, bike or walk and avoid public transport if possible. Please keep in contact with your employer. Employers not following the COVID-19 secure standards are to be reported to the Health and Safety Executive. Parents who cannot provide adequate childcare for their children should not go back to work. Remember, this is a new disease and everyone is learning. If the 5 steps continue to be followed, then on June the 1st, nurseries, reception, year 1s and year 6 may be allowed to open, provided they have COVID-19 secure standards and 2 meters of social distancing is maintained. It is the hope that all primary school children will get at least 1 month school before the school holidays. It is also hoped that secondary pupils facing exams next year will get the chance to spend time with their teachers before the summer holidays. Again, as long as COVID-19 secure standards are in place. Please keep in contact with your school. Those with underlying health issues must continue to stay at home. Over 70s who are fit and active with no underlying health conditions can go out but must take care. We may even get to see some sporting and cultural events broadcasted behind closed doors. If all this is successful, then around July the 4th, some public places, shops, hairdressers, bars, restaurants, etc. may be allowed to open again, provided they have COVID-19 secure standards and 2 metres of social distancing is maintained. Please remember this is all conditional, and should the infection rates begin to climb, i.e. above 1, we're between 0.5 and 0.9 at the moment, then strict lockdown measures will be enforced immediately. Face coverings, not the ones used in hospitals, are recommended in spaces where social distancing is difficult, i.e. public transport and in some shops. We can meet up outdoors with one member of another household as long as social distancing is maintained. This is so that the R, the rate of infection, can be monitored. We can travel around to exercise and enjoy the outdoors, but I'm asking for common sense. Stay local. This is not a green light to travel the length and breadth of the country. Wales, Scotland and Northern Ireland still have relative high numbers of deaths in comparison to England, and they are staying in lockdown, so don't travel to these areas. As more is known about this virus, the guidance will change, but I'll try and keep everyone updated as we continue to battle with it. We have to dip our toes in the water, but at the same time save lives. The government are allowing us to use our common sense, and I know I can count on 99% of our residents to do this. We've had over 200 deaths today, and I know that we will be thinking of all their families and friends at this time. So let's do this. Let's work together with our employers, with our schools, with the police to keep our community safe and ultimately save lives.